Hey there everybody, Seja Popham here, founder of the School of Evolutionary Herbalism, and recently got a question in from a student that I thought would be a valuable piece of little information to share with the greater community here. And this question is around how many herbs is it okay to give someone at one time? This can be you can get a varied variety of answers from different herbalists, really depending on who you ask this question to, in terms of differences in approaches. Some herbalists might feel comfortable giving dozens and dozens of remedies and really big, large, complex formulas, and on the whole other end of the spectrum, someone maybe only feel comfortable giving one remedy at a time. And this is also a really pertinent question when it comes to complex cases. When you get a client that comes to you with a dozen primary complaints that are all over the place, how do you determine what the priority is? How many formulas do you give? How do you not overwhelm your clients? How do you make sure they'll be compliant with your protocol? So this is a really important question from a clinical standpoint. That is what the topic of discussion is for today's post. So I hope you enjoy learning a little bit more about how many remedies to give at one time. All right, question number 5 from Kate Boscher. How many remedies is it okay to use at one time? For example, someone who is having some quite severe digestive issues, struggling to digest, has leaky gut and malabsorption problems, which is then causing a nervous system dysregulation and hormonal imbalances. The gut is the root cause, but now these other systems going out of balance is also affecting digestion. Can one use a bitter tincture, something like an adaptogen, and then maybe an essence to help them more on emotional spiritual side? Is it okay to use remedies like this in conjunction with one another, or should they be introduced one at a time over a period of time? Yeah, this is a really, really great question, Kate. And it's kind of a complicated question because, as I'm known to say, there are no really set in stone rules in herbalism for things like this. It's just different practitioners have different styles. Some people give one remedy, some people give dozens of remedies. Some people are right in between. So it's really hard to say what is the best. And honestly, for me, I think it really comes down to a handful of factors. One of which is, it really depends on the client. It depends on their condition. It depends on the severity of the condition. And it also depends on how much they're willing to do. You don't want to give. I think one of the biggest mistakes, especially a lot of newer practitioners make, is they give their clients too much. They're like, okay, here's this tea formula, and here's this decoction, and I want you to take this tincture in the morning, and this one in the afternoon, and this one in the evening, and here's the different dosages for each one, and I want you to do this to your diet, and I want you to do this kind of exercise, and I want you to meditate like this. And they, and the client's like, and they don't do any of it. And they're obviously not going to get better if they're not compliant with your protocol. And so how many remedies is it okay to use at once? I think it really just depends on what you're trying to treat. And I think it depends on the level of compliance with the client. Now, personally, I don't like to give much more than 2 different remedies at a time, mainly because I want to try to assess what's working. And if you give too much at once, it's like, how do you know what's actually giving the healing result that you're looking for? And I think one of the key ways that we as practitioners can start to simplify the protocol, simplify the number of remedies that you give, is seeing overlapping properties in your herbs, right? In your example, you're talking about digestive issues that are leading to nervous system stuff, and the nervous system stuff is feeding into digestion, and the digestion stuff's feeding into nervous system stuff. And it's kind of this vicious cycle that's happening. So, rather than giving something like Oregon grape, dandelion, and peppermint and fennel for the digestive system thing, and some hops and valerian and skullcap for the nervous system thing. Well, what about using herbs that have an effect on the digestive system as well as on the nervous system, right? Things like chamomile, really great bitter tonic, really great carminative, but also really great nervine. Lemon balm, carminative properties with nervous system sedative properties. Motherwort, great digestive bitter, super bitter herb, right? But also great for the nervous system. Hops, another great digestive bitter that also sedates the nervous system. So this is one way that you can start to narrow your remedies down, is by seeing like which herbs are covering the broadest spectrum of actions and affinities that you're looking for. So when I'm working with a client, what I end up doing is I kind of have this way of doing my case review, where after I've done the whole intake and I'm kind of getting ready to put their formulas together and such, what I end up doing is I go through all the notes and I start making lists. Okay, what are all the key affinities that I want my herbs to be working on, right? So in this case, it sounds like you've got digestive stuff, nervous system stuff, and endocrine stuff. Okay, then what actions do I want my plants to have? Well, do they need bitter tonics? Do they need carminatives? Do they need antispasmodics? Do they need nervine sedatives? Do they need hypnotics? Do they need adaptogens? Like what types of actions do they need? And then from there, what do I want the net energetics of the formula to be, right? Do I need to warm them up, cool them down, moisten them, dry them? Like where do they need correction energetically? So then I take that and I step back and I look at that and I ask, are there any herbs that do all of that? If you can find like one or two herbs that cover most of those things that you list out, that is going to be a specific remedy for that person. It's like the pattern in the plant matches the pattern in the person. But, you got to know your remedies really well, and you got to be able to really assess your person really well to kind of get to that point. So more often than not, we end up formulating. So maybe you find some remedies that cover a majority of those properties that you're looking for, and then you find other herbs that fill in the gaps. Putting some synergists in there to correct the energetics, or putting some drivers in there to circulate it more. Maybe you find an herb that covers all the actions except for this one, so then you add another indicated herb that covers that action. So I'm sharing this because this is a way that you can narrow down the options, like not the options, but narrow down the amount of remedies that you're giving to someone. Now, the other approach so that's kind of approach number one. Approach number two that I think is good to think about is, like, what are the layers of the onion here, right? Like and this is where you do timelining. Like when was the onset of, you say you have symptom 1, symptom 2, symptom 3, symptom 4. Okay, well, what were the onsets of those symptoms? And then you timeline that. So what you're able to do there is see, okay, this digestive symptom started here, and then this happened. Maybe they drank some bad water and had to take a bunch of antibiotics or something like that. And then this symptom started here. And then this happened and that symptom started. And then what you're seeing is the progression. You're seeing the layers of the symptoms, and hopefully being able to trace the onset of those symptoms back to a cause. And the cause of one symptom might be, a marker point. It was something happened, a trauma, or they had to take some antibiotics and that affected their gut health, or they got a parasite and nothing was the same ever since. Or it's this symptom started, it went on for this long, and then this symptom came up that was a result of this problem. And so one of the ways that, rather than trying to address every single one all at once, there's there's two approaches. Sometimes it's appropriate to just go back to the original thing and address that and hope that everything that emerged from that will ultimately balance out. Or there's peeling the layers of the onion back, right? So you start with the most recent one, you address that, you correct that, you balance that, and then that's settled, and then you go into the next one, and then you work with that, and then you go into the next one, and you work with that. And so that's kind of looking at it more on a longer timeline. Which is correct? Is it best to just hit the first thing that started and hope that everything that followed will kind of self-correct, or do we peel the layers of the onion? I don't know. It differs from person to person, case to case, and this is what I mean when I say there's no real hard, fast rules here. It just is going to differ from person to person. Now, there are cases with gut health stuff where, especially with gut health stuff, where all this systemic problems start to develop from the issue in the gut. The headaches or the eczema or the joint pain or the brain fog, the fatigue, the depression, the anxiety, that, maybe you tried it. And in a lot of those cases, peeling back the layers of the onion doesn't really work all the time, right? Where if someone's having chronic eczema on their skin and headaches, but it's because they've got antibiotic trauma in their gut, they've got leaky gut, they've got food allergens, they've got systemic inflammation rooted in the gut. It doesn't matter how much cleavers and red root and red clover and stuff you try to give them for their eczema and how many headache remedies you give them to try to fix the headaches. It's like, if we don't correct the problems in the gut, those other issues won't resolve. So, okay, so I know that was a lot, but so this is where we get into strategic approaches of herbalism, and it's like, okay, our job is to alleviate suffering. So if someone's got headaches that are really, really bad, we should give them something to help them with their headaches. But we don't want to just give them something to help them with their headaches without trying to correct the underlying root cause. But that underlying root cause might take maybe months to heal. So we don't want to just leave them high and dry and just say, well, you're going to have to tough it out while we work on the core issue. It's like, no, there is an appropriate place for allopathic herbalism of treating their symptom, right? Because we want to alleviate their suffering. So, and this is where you can get into some more complex protocol, not necessarily complex, but more involved protocols where you will give maybe a remedy for the acute things that they're facing, while at the same time they're working with remedies to correct the underlying root cause. Personally, I try not to go beyond 2 to 3 different formulas. Because in my approach, I feel like if there's too many herbs going on, I just feel like it gets overwhelming for the body. I think smaller focused formulas, smaller focused protocols, I think are more effective. And that's just been in my experience with people. Each herb is so complex. There's so much going on in a single remedy. I'm not the kind of herbalist that gives people 60 different plants all at once. I just think that's too much. That's just me. I'm not saying that approach is incorrect or wrong. Certainly, traditional Chinese medicine and Ayurvedic medicine gives really big formulas. Maybe I'm just not experienced enough to really know how to do things like that. But I also I like simple. And I think the body likes simple too. So certainly giving someone something to address the core root cause while you are giving a remedy to address the acute symptoms. So in this situation, we're talking about severe digestive issues, struggling to digest, leaky gut, malabsorption, that's all connected. And then some nervous system stuff and hormonal imbalances. Well, what I would say is I would suggest giving a formula to support the acute digestive problems, but giving herbs that are also going to address the nervous system dynamics at the same time. So giving a good digestive bitter, a good digestive carminative that also has some nervous system properties, or just giving a formula that has some bitters, some carminatives, and some nervines in it that will address the acute situation, while you're also giving a leaky gut tea or something. You're having them make a tea that's going to help heal the leaky gut, reduce the inflammation in the gut, calm and settle everything down. And alongside things like, probiotics, and maybe addressing a single dietary factor at a time or something like that. And then kind of explaining to your client too, like, here's what these are and what they're for, rather than being like, take this one 3 times a day, take this one 3 times a day at this dosage and go for it. I find that it helps with compliance if the client understands why they're taking it, like what it's for. Of course, you got to be a little careful in how you explain that, that you're not, making claims or saying it's going to cure them, and just the logistics of practice, and not, basically practicing medicine without a license. But so you have to be careful about the way you're talking about it, and then going from there. So those would be some of my suggestions to you there, Kate, in terms of how to navigate, how many remedies to give. I know that wasn't a very straightforward answer, but it's just some of the things and factors to consider when you are putting together protocols for your clients, so that you can have the most success with them and that they can get healed. And I think it comes down to really balancing the acute, short-term things they're struggling with right now, with the deeper level, longer-term root cause kind of dynamics that might take longer to heal, but ultimately will bring them kind of that transformation that they're looking for within their body, and the curative. Basically that's a long way of saying balancing palliating symptoms versus curing root cause. And I think as herbalists, we can do both. And that's a good way to practice. So there you go. Hopefully that helps.